When journalists spend months working on a difficult investigation, their biggest hope is that it leads to some real-world change, and that's exactly what my colleagues at the Banner have accomplished. Last month, they published an article in collaboration with the New York Times where they investigated a Baltimore-based addiction treatment provider called PHA Healthcare. PHA Healthcare has received millions in state funding every year, but when Banner reporters spoke to former patients there, they heard harrowing stories. My colleagues discovered that PHA Healthcare had been putting patients in housing where people were allegedly selling drugs. Many patients ended up relapsing, overdosing, and some even died, including a 1-year-old child who starved to death after his mother suddenly passed away in the program's housing. 3 days after that article ran, the state ordered that PHA Healthcare cease and desist its outpatient program, basically forcing it to stop treating people. And just this week, PHA Healthcare's owner said that it had stopped treatment services. However, the program is still housing patients, and we'll be covering what happens to them next. It's an example of how people sharing their stories can change policies and laws for everyone, especially for vulnerable people. This was our third story about opioids in a reporting partnership with the New York Times, and if you want to support our work or read more about it, then you can click the link in our bio.